Uh, Good morning, good afternoon, everybody. It's afternoon in Canberra, morning in for some people. Just while we're just waiting for people to come online, we'll be starting in a few minutes. If you could introduce yourself in the chat, your preferred pronouns, and perhaps what country you're on would be great. And then we'll get started in maybe a couple more minutes, just letting some more people into the webinar. Okay. Well, we might get started because we've got quite a full agenda today, so I think we'll get started, and other people can join us as we go. Good afternoon, everyone. Welcome to today's webinar, helping you to understand how to best utilise your My Health record to store your important health information. I'm Jo Root. I'm the Director of Policy and Research here at CHF, and I'm hosting today's webinar and facilitating the discussion. For those of you who have been on our webinars before, you know that we record them and make them available to rewatch on our YouTube channel. So if you miss anything, you'll be able to catch up on it there. Just a reminder that AI scribes are only permitted for accessibility purposes unless previously approved by CHF. Thank you for your understanding on that. It is sometimes an issue. Okay, so I'd like to acknowledge the traditional custodians of the lands on which we're all living and working today, and their continuing connection to land, water and seas. I'm on the lands of the Ngunnawal and Ngambri people here in Canberra, and I'd like to acknowledge any elders from the Ngunnawal and Ngambri people, and acknowledge any other Aboriginal and Torres Strait Islander people who may be attending today's meeting. It's always important to remember that we have very different health outcomes for our First Nations people, and everything we do should be designed to reduce that inequity and help to close the gap. So now we'll go on to today's webinar okay. What we're talking about today, first, that doesn't seem to be the right slide. Oh, never mind. Hang on, here we go. Sorry about this, I'm having a technical problem. Today's webinar is about discussing practical tips on how to make best use of the platform. And we're really delighted to be bringing you this webinar in partnership with the Australian Digital Health Agency. My Health Record is and can be a really powerful tool, digital tool for you to help manage your health and for you to see what's going on for you. I think it's often misunderstood. So we're hoping to clarify some issues for you, and that you will then feel more confident in using your health record to help design your manage your health. We're going to have a presentation from the agency. We're going to hear from our two consumers who sit on our panel and sit on our digital health panel, and we're going to have the presentation, and then there'll be a chance for you to ask some questions. So it's a pretty standard process. If you've got any questions, if you can drop them in the Q&A, that would be really helpful. Use the chat for comments, for having a chat with each other, for commenting on what's being presented. But if you've got a question you want answered, if you can put it in the Q&A, that will also help us. We'd also like to remind you to express your views on what's going on by using the reactions and emoji in the reaction area of Zoom, which is down the bottom for most people. It's emojis. You can clap, you can do things that send up a love heart. You can do things that show what you're feeling about the presentation and the webinar. We're going to start off with a poll for the webinar, and we're going, if we can put the poll up there. So the poll's up, and as you can see, it's quite simple. It basically says, do you currently have a My Health record? Just fill in one of those, and then we'll go back to the results in a minute after we've moved on. So I'll just give you a little while to fill that out. And then you can, we can move on. So hopefully everybody's done that, so that's great. I'd like to now move to one of the most important things that we do, which is to introduce our consumer representatives. I'm really delighted to introduce our two consumer members for today's discussion, Pip Brennan and Shu Chen. You can see from their bios that we have added into the chat just now that Pip and Shu have a wealth of experience. Many of you may know Pip from many of the things that she's done, and Shu has been doing a lot of work with us. So Pip and Shu, thank you so much for joining us today. And I think what we'll do is to start up things off. Can you introduce yourself to the audience? So I'm not sure whether you've worked out who's going first. Perhaps you can go first, Shu.
Okay. Hi, hello. Hello, everyone. My name is Shu. I am a member of CHF's Digital Health Project Consumer Panel. I have been a health consumer representative since 2019. I have also been involved in some health research projects as chief investigator or associate investigator. I have lived experience of several chronic health conditions, and I have a professional IT background. So I have keen interests in digital health, mental health, and chronic illnesses, and medical imaging, and some telehealth services. So as you can tell, I'm from CALD community. So I'm also keen to help to build a better healthcare system for Australia's multicultural society. Thank you.
Thank you so much, Shen. And now we might go to Pip.
I am so happy to be part of this panel. Thank you for the opportunity to be here. I've been a consumer rep for 26 years, and I was lucky in a way that my first interaction with the health system was a maternity one, and it was actually a good outcome, but I was rather cross with how medicalised our maternity care system was and how difficult it was to access evidence-based midwifery-led care. And that's what started my journey. And over the years, I've had the chance to learn so many different things over the roles I've had, including I was a conciliator of health complaints for a while, and I had the honour of running the Health Consumers Council in West Australia for 7 years. Interestingly, I've had 3 careers. My first career was a museum career, and actually it began because I had IT experience. So I'm a little bit nerdy. I'm very interested in digital health because it's one of those potential disruptors and empowerment mechanisms for consumers, and it touches every aspect of our health system.
Thanks very much, Pip. As you can see, two consumers with experience as consumer representatives and also with some strong interest in digital health and helping make it work for other people as well as working for them, which is really great. And we're very happy that you were able to join us. We'll be checking in with Pip and Shu throughout the webinar, and they'll be part of the panel that you can direct your questions to. So we might move now on to the presentation. The presentation is going to come from Kern van Benet, who is the Digital Educator Partnership and Education Policy Programs and Engagement Division in the Australian Digital Health Agency. You can see his experience in his bio, and that we've added to the chat. He's just told us that he used to run science classes at the museum, science sessions for 8-year-olds at the museum in Sydney. So he's used to sort of dealing with people who perhaps don't want to pay attention. So this is going to be much easier for him, so he says. So we'll see. He's got a fair bit of information to get through, and we don't want to overwhelm you with too many PowerPoint slides. So we're going to break his presentation into 2 parts. And between part 1 and part 2, we will go to Pip and Shu for their thoughts. And before we go to him, though, we want to see the result of the poll. So if we can see the result of the poll, yes, so that's pretty good. What I will say to the thanks, Shannon, what I'll say to the 10% of people who say they don't know is you've got one. So we can take that up to 89%, because if you didn't consciously make a decision not to have one, you've got one. So you should go and find out, and and make a decision whether A, you want to keep it, and B, if you're going to use it. Hopefully our webinar today will help you make the decision to keep it and to use it. So that's pretty consistent with, I think, the Australian population of about 90% of people have got a My Health Record and 10% chose not to for a variety of reasons. And so now I'm going to hand over to Kern for the first part of his presentation. Thank you. There's a bit of a lag.
Yes, can you see me?
Yes, you're fine.
Good. There's a little lag. Yes, that's right. Hello, everyone. Able to see my screen? Something's not going well here. Let me just try that again. Give the system a bit of time here. Bear with me, please. Okay, let's see.
Right.
I can, sorry,
You're
Joe,
fine.
can you see my screen? Because I'm not seeing the highlights.
Yeah, we can see your screen.
Okay, beautiful. Wonderful. So let's get this started, everyone. Thanks for the introduction, Joey. My name is Koen van Venetië. I know that's a very tricky name. It's a Dutch name. I pardon for my accent in advance, usually, but please bear with me. And I hope you can learn something new about my health record and in ways how you can use it to your best benefit. So before we start, if you have any questions, you can add these to the Q&A section. And I know Joe has mentioned this before, and we'll try to answer them straight away or in the panel discussion afterwards. I must place a little disclaimer there. Due to time constraints, we may need to take your questions on notice. However, we'll try everything we can to answer them. Now let's learn some more about how to make the most of my health records. There we go. So let's have a look at what we're going to cover in today's session. We will talk about how my health record can support you to manage your health. To do this, we will have a closer look at what my health record is and how it can benefit you, including how you can use it and where to access it. One of the main advantages of my health record is that it enables you to take control of your health journey. We will explain which part of the system you can control, including privacy settings and documents you can add yourself to your record. We will have a closer look at what information is actually in it, but also get an understanding of how your health information is kept secure and who can see it and who can't. Finally, we'll close with where to learn more about my health record, digital health, and also where you can find the self-paced e-learning modules from the Australian Digital Health Agency that are available to you. So what is my health record? Well, to answer that question, I'd like to start by showing you a video of Oscar. Oscar and his family live in remote Western Australia, and Oscar has a chronic disease called ICP, which requires care of multiple healthcare providers. The video shows, I think, quite well how digital health care changed his parents' lives while caring for their young son with chronic disease far away from specialist healthcare. Let's have a little look. We can start this up.
Oscar is just a ball of energy.
I think the thing I love about Oscar is just how easygoing he is.
Always up for an adventure or a challenge. He's had to grow up really quick, kind of being in an adult world in a sense. You know, a lot of people talking about him, quite often around him.
Oscar was 2 years old when we noticed that he was bruising quite badly. Eventually, after a few doctor's visits, we found out that he had ICP.
ITP is idiopathic thrombocytopenic purpura, which basically means that his immune system attacks his own platelets. So when his platelets are quite low, he's at risk of hemorrhaging.
For me, it was
Then we seem to have lost the video.
Yeah, excuse me, everyone. Bear with me. I'm having a little technical problem here. Something did not go well there. Let me try that again. Pardon me for that. And you should be able to see the screen now. Do you see
Oscar
this?
is just a ball of energy.
I think the thing I love about Oscar is just how easygoing he is.
Always up for an adventure or a challenge. He's had to grow up really quick, kind of being in an adult world in a sense. You know, a lot of people talking about him, quite often around him.
Oscar was 2 years old when we noticed that he was bruising quite badly. Eventually, after a few doctor's visits, we found out that he had ICP.
ITP is idiopathic thrombocytopenic purpura, which basically means that his immune system attacks his own platelets. So when his platelets are quite low, he's at risk of hemorrhaging.
For me, it was one of the scariest things that a dad can go through.
That night in hospital, that first night, I remember just, you know, it's all quiet and it's just me and him, and I looked at Oscar and I just thought, like, sorry. All that we've taken was falling off the trampoline. We always request for Oscar's records to be sent to Plaza Medical Centre, because I know that if it gets sent to Plaza, then they'll upload it for us to My Health Record so we can have access to it as well. Dr. Kylie actually, in those early years when the My Health Record first came out, it was actually during an appointment with her that she said, hey, have you heard of this? You know, I think it'll be really useful for you guys to get it set up.
We've used Oscar's My Health Record really efficiently to communicate between his hospital care team and me as his GP. So it means that I can see the pathology ordered by his specialist. Jeannie and Tim can see pathology results when they're uploaded to Oscar's My Health Record. And it means that he has less investigations because there's not double up of pathology.
With patients like Oscar, blood tests are uncomfortable, can be quite painful, very stressful for a young child. The last thing you want to do is have to duplicate blood tests that have already been done. My Health Record makes life a lot easier for that family and for that little boy Oscar.
Digital health means you can get the best quality of care wherever you are in Australia. In Western Australia, we have a very large state. We're about a third of the continent, and many of our hospitals and healthcare facilities can be quite remote. being able to get that best quality of care from digital health actually is essential.
Living regionally, it's a 7-hour trip each way to Perth. It costs us a lot of money, plus accommodation. Telehealth has just absolutely changed the game.
We've just recently had a telehealth appointment with these specialists, and they can see him and they can talk to him and they can interact with him, and they've still got all his blood works there. It just means that I can do it anywhere.
When parents have kids with serious illnesses, they often feel quite powerless. And what My Health Record does is they can log on to My Health Record so that they can feel empowered to be actively involved in their child's care.
It's so much easier for new doctors to see Oscar's journey. We want to travel all over Australia, so to have all that information with us on a computer or even a mobile phone, it gives us great peace of mind.
Thank you, everyone. All right, let's keep going. Okay, well, I hope you enjoyed that little video. So before we continue, yeah, just a little heads up. I know the organization that I work for has a very large name, the Australian Digital Health Agency. We often refer to it as the agency, and I think for everyone's ease of use, I'll use that term from now on. So let's get started with what is My Health Record. My Health Record is one of the digital health services the agency offers. It forms together with electronic prescriptions and telehealth, Australia's connected healthcare system, supporting modern and accessible healthcare. As you can see, Oscar's video shows us how it really helps Australians live healthier and actually better lives with greater control and better access to their information. So what is it? My Health Record is a summary of your key health information. It is personally controlled, which is a key element of the system. And this means that you have say as to whether you have a My Health Record, what gets uploaded, what stays in your record, and who can see your record. You also have access to your My Health Record access history, which is a page that shows, that actually gives you information about everyone who has access to your My Health Record. Importantly, My Health Record is part of a national system, which means it travels with you, wherever you are and no matter which registered healthcare provider you're seeing. Your My Health Record is accessible at all times, including at the point of care by you, your authorized representatives, and healthcare providers who are involved in your care. Your record can be viewed and added to, subject to the access controls you've set. Now, last but not least, importantly, My Health Record is private and protected via legislation, primarily the My Health Record Act. It is secure through multiple layers of international best practice in IT security. For example, we have a cybersecurity center, which monitors, maintains, and improves the system 24/7. These include strong encryption, firewalls, secure login processes, and audit logging. All data within the My Health Record system is stored securely in Australia. So, and this kind of leads back a little bit to the poll, probably the 10% that said, I don't know, this one is all for you. A very common question indeed is, do I have a My Health Record? Now, from February 2019, everyone in Australia with a Medicare card was automatically given a My Health Record. So unless you decided to opt out, you probably have one. Now, if you have arrived in Australia recently, you may have selected to have a record as well. Now, if you are a person who does not have a Medicare or Department of Veterans Affairs, also known as DVA benefits, you may still be able to register for a My Health Record. We'll talk a little bit more about that later, but I suggest you have a look at the link that Shannon will share with us right now. That gives you actually ways to actually request access to your My Health Record and to sign up. But as I said, we'll dive a bit deeper into that in a minute. Okay. So this slide shows you the list of available documents in my health record. It shows you what's in it. The documents come from roughly 3 different sources. Actually, that is 3 different sources, I should say. Healthcare providers, Medicare, and the consumer. And the consumer, that's you, including me. Now, your healthcare provider enters data, which are clinical documents. You can think of health summaries that your general practitioner, for example, uploads, discharge summaries coming from after you got discharged from hospital, test results from pathology labs, and specialist letters. Then there is also Medicare source information, which includes, for example, immunization information from the Australian Immunisation Register. There's also medication information from the Pharmaceutical Benefit Scheme claims, and there's also Medicare information coming straight from My Medicare. Now, that all belongs on the left-hand side, and you see that's under a header saying viewing your record. As a consumer, you can only view that particular information that I just listed. There is also, however, a large part where you can actually enter yourself, and that's interesting. That will make it much more your record, right? So what we call consumer entered data can be information like a personal health summary. This is where you can add information about your allergies, adverse reactions that you have to certain medication, for example, or other things, medicines you are taking that are not listed. And that's actually also visible to healthcare providers. The next point is personal health notes. Now, this is an interesting one, I think, because sometimes you just want to keep notes of your own health, but not really in a way that a healthcare provider should see it. That's what you use your personal health notes for. They are not accessible for healthcare providers, but they are accessible for any representatives that you have. And we'll talk about this later, what they are. We have nominated and authoritative representatives. We'll cover that later, but just to get you a bit in the right zone. Then there's also emergency contacts details and also advanced care planning documents that you can add yourself. Now, these are all things that make your My Health record a more personalized record. Yeah, and I hope it gives you a bit of an impression of what can be all in it. So now we know that almost all of us have a My Health record and what it is. The big question is, how can you look at it and maybe even add information to it? Let's find out. Now, this might be a slightly overwhelming slide for most of you. I remember the first time I saw this one, I was like, ooh, there's a lot happening there. And why is there healthcare providers and consumers on this page? Let's cover that one step at a time. Let's first look at the healthcare providers. How do they access My Health record? Well, as you can see, healthcare providers can only view and upload healthcare information with what we call conformance software. That means that the software is tested for safety and security by the agency before it is allowed to connect to the system, the My Health record system, that is. This information, I think, is very useful for us consumers because it just shows you that it kind of takes two to tango. Now let's continue to the consumer side because that's probably what you're really interested in. You can see here, consumers can view their My Health record via MyGov linked services or authorized apps such as the My Health app. These apps are all read-only with the idea that you can access your information on the go. Again, you won't be able to add information in that way. However, to add information to your record, you need to log into My Health record via your MyGov account. And you can do this from your phone or any device connected to the internet. And there you can add the documents that you want to, or any information you'd like to add yourself as listed before. And just to stipulate, it's good to know that healthcare providers are very regulated and controlled in the way that they upload the information. However, without that information, My Health record would not exist. So it's quite important to have a bit of a peek into that world as well, I think. Let's continue. Let's have a closer look at the My Health app. you can see the quite old-fashioned phone on the right-hand side. I think we're quite a couple of versions further of this phone model, but for the idea, you see there a screenshot of what the My Health app looks like. And what you can do after you've installed it on your mobile device, you can actually use it to download documents from your My Health record onto your mobile device. And it also lets you share documents that contain your health information with other people or organizations. It can be very convenient when you're, for example, traveling overseas and need to visit a foreign doctor, as they cannot access your My Health record from the system, since it's only accessible from Australia. But if you actually have your app and you have downloaded documents that you find very important for your healthcare, you can share these with foreign doctors if needed. Yeah. Another really great thing that I like about the My Health app is the accessibility. So it uses the accessibility settings of your operating system of your phone. That means that if you, for example, need bigger font sizes to read, to make it more legible, like readable, the app will take that over from your operating system. So the app is actually also accessible. Okay, so how do you access your My Health record for the first time? So this is for the, I think the 5 to 10% that not have a My Health record yet, or consciously not. Anyways, if you'd still like to sign up and access it, this is how you do it. Pretty straightforward process for which you'll need your MyGov login details. After signing into MyGov, you'll need to link your My Health record to your MyGov account. And then you'll be asked to verify your identity using a range of information and documents, including a Medicare or DVA card. Then once that's done, you can set up your My Health record and access it. Now, this is actually a slide that might be very interesting to know. Gives you a bit of a peek into what happens in the background of the My Health record system. So as mentioned in the former slide, you'll need a Medicare or DVA card to set up your My Health record. What if you do not have either of these cards? Can you then still get access to your My Health record? Well, in that case, you can request to register for an individual healthcare identifier, as we call that, which is essential if you want to register for My Health record. You say essential, Koen. Well, yeah, do I have it then if I'm already signed up? Yes, you do. If you have a Medicare card or a DVA card, or you're enrolled in Medicare, the individual healthcare identifier is associated with it. And what it does, the individual healthcare identifier, it makes it possible for healthcare providers to associate your information, your health information, with you in the information systems that they use. Now, if you don't have a Medicare card, you don't have a DVA card, or you're not enrolled in Medicare, you do not have an individual healthcare identifier yet. If you want to register and you want to request one, you can do that online or use a form. Important note there, you need to be in Australia to do this. We will share some links now in the chat with more information around this. So to wrap this intro into My Health record off, and we'll later go into the benefits, I promise, but this is the first section. I'd like to give you a couple of numbers just to give you an idea that there's actually a lot going on the My Health record front. There are currently 24.1 million My Health records. In those 24.1, I should say, 24.1 million records, there are over 1.4 billion documents uploaded by consumers or healthcare providers. Now, on the screen, you can see the breakdown is about 601 million clinical documents that are uploaded by healthcare providers, coming from hospitals, pathologists, and specialists. There are 891 million medicine documents uploaded by healthcare providers like GPs or pharmacists. And these can be, think of medication prescriptions, things like that. And there's 535,000 consumer documents uploaded by people. Think of personal health summaries. This shows that most of us have a My Health record and that there is a lot of data in them. Now, to close this off, I've been talking a lot. May have overwhelmed you a little bit with this information. I'd I'd like to give the panel a chance to reflect on this. So first over back to you, Joe. Thank you.
Well, thanks very much, Koen. And so I'm going to ask Pip and Shu whether you have any comments on any of the aspects of My Health Record that Koen's mentioned so far. So Pip, did you want to go first? Is there anything you would like to highlight?
There are a few things. So I'll try not to take too much. I wanted to think a little bit about, we talked a bit about what is My Health Record, and we talked about access and view from a clinician and consumer perspective. So I might just very quickly, I just wanted to reflect that there can sometimes be confusion between what My Health Record is and what a state-based or territory-based electronic medical record is. And I think just wanting to highlight that usually an electronic medical record is what happens inside a hospital, whereas My Health Record is that really important journey all the way through and is summarised information only. And from a consumer perspective, we want to push for any electronic medical record vendor to have to be compliant. We really want to keep My Health Record. And that is because My Health Record gives us control and it gives us access. So I just wanted to flag too, with the picture of the app, it is slightly out of date. And I wanted to highlight that there's a couple of really good tools to help us with our informed consent process. There's a button that says find health services and check symptoms, and it allows you to get onto the Health Directory of services. It allows you to look at what are my symptoms, and it also allows you to have a look at tests and treatments. Do I actually need this test and treatment? So I think that's one of those things that I whinged about a little bit, and I'm very happy to see that that's been actioned. I think I would just reflect too that a lot of numbers, it's great to have a lot of numbers, and I'm very, very pleased about the lot of numbers of information there. But from a consumer perspective, how can we be empowered but not swamped? How can we have like digital information that really empowers us around our health? I'm just very quickly going to talk about the provider perspective. Uploading documents, I'd like to make sure that my understanding from providers is that the system that they use to upload things is a bit old and clunky. I would love to think that we make it as easy as possible as we can, because from a consumer perspective, we would like to mandate that they upload the information, because we have control as consumers about what can be seen and what can't be seen. But we can't see something that's not uploaded. And while we've got really good rates around public hospitals, private hospitals are lagging behind. And, you know, sometimes this means a lot of extra tests and treatments for consumers that we don't need, or it may even be the difference between life and death.
Thanks very much, Pip. And I think part of what you said there answers one of the questions in the Q&A about how do we get health professionals to load people's information up, because this has been a constant problem. You know,
I'm a believer in mandation. Mandatory.
Okay, well, you've heard it here. Shu, did you want to make any comments or add anything to what Pip has said?
Yeah, I totally agree with Pip, and I'm so glad to see that the pathology centers at Queensland, they started to upload the results to My Health Record without consumers having to make requests. So I used to have to call them to upload the results to My Health Record every time. So I'm so glad to see that progress. And from my experience, that I understand that there are some concerns about the privacy and the data security of the My Health Record. So my suggestion is, when people decide, or when people want to decide whether to use My Health Record, they need to weigh pros and cons, and make an informed decision. And for me, My Health Record is definitely suitable and is a powerful tool for me, and I will continue using that.
I totally agree with what Shu said. And I just wanted to say, it's not a final decision. If you decide at a certain point in your life you don't want a My Health Record, you can change that if something changes in your life.
Yeah, I think you've got a bit of support for mandate, Pip, in the chat, so you'll be pleased to see that. And yes, I know it's something that's been discussed. We have a couple of minutes. Did you want to add anything, either of you, to your comments, or else we can go to Kern and go to the second part of his presentation? You're right? Okay. Kern, it's up to you. Over to you.
All right. I think you can see me all again. You can't. Yes, you can. Let's share that again. All right. Welcome back, part 2. This is a topic that already got kind of touched by Shu. Thanks, Shu and Pip, for your insights on this. I'm very happy to hear all your ideas and suggestions around mandating and also yeah, how to move forward with my health record and all digital health. It's very insightful. So thank you for that. Now let's talk about a big topic. Privacy and security of my health record. So to set your expectations, this webinar is not about that very topic, so I'll keep it quite short because we got a lot more ground to cover today. However, we recognize that for most people, this is a very important topic, and therefore the agency and CHF will host another webinar specifically on the privacy and security topic later this year. But feel free to ask questions if you have them, obviously, around it. All right. How do we keep your health information secure? So many safeguards are in place to protect the information held in the My Health Record system. Think of things like encryption, firewalls, secure login processes, and audit logging. There are privacy settings, people, technologies, processes, and legislation involved in keeping the information held in My Health Record secure. So let's first look at the settings. So this is the part where the consumer and you as a user play an important role. So you are able to control the privacy settings within the system, which we'll look actually at the next slide. And these settings control who can see what within the system. People. The My Health Record system is monitored by the Cybersecurity Center within the agency. All personnel involved with that administration of the system undergo security checks just to make sure it's all safe and secure. Technology. The My Health Record system uses a layered security model with multiple security controls in place to protect the confidentiality, the integrity, and also the privacy of your healthcare information. All data within the My Health Record system is stored securely in Australia. The next one is process. A range of security processes limit access to My Health Record system. For example, external software is tested for safety and security before it's allowed to connect to the system. This includes healthcare provider software, but also mobile applications involved. Last but not least, it's all supported by legislation. Your My Health Record and your rights are protected by law. The primary purpose of your My Health Record is to support your healthcare. That's what stands primary in this. No one is permitted to access or ask you to disclose any information within your My Health Record for insurance or employment purposes. The information from your My Health Record cannot be released to law enforcement or a government agency without your consent or a court order. Your health data also cannot be sold or used for commercial purposes. It is a criminal offense for someone to access your record for a purpose other than providing you with healthcare. And there are serious penalties for this. So as promised, let's talk about privacy controls. This is the way you can manage which healthcare organizations can see your record. The first little dot on the left shows you one of the ways to restrict access to your My Health Record, and that's by using a so-called limited document access code, as we like to call that, an LDAC. This is where you can create a code to restrict access to specific documents in your My Health Record. So if you have a certain healthcare provider which you don't want to show your last test results, but the rest is fine to be seen by this person, well, you can set that up here. And you can then share this code with the healthcare providers you trust to access it, and the code will give them access if needed. The next blue dot is another way that you can restrict access is by the record access code. This is a set code to limit access to your entire record. Then only those with the code can view your whole record. So that's quite different from the LDAC. The LDAC gives you only limits access to certain documents. The RAC, or the record access code, will restrict access to the complete health record. The next point, in emergencies, healthcare providers can use a so-called break glass function to access your record. That means it overrides codes, but these instances are monitored and logged, and usually this is only used in a life or death situation. Again, it's monitored and logged, and if not used properly, yes, there are consequences. Another privacy control feature is the SMS or email alerts feature, which alerts you when a new healthcare provider accesses your record or uploads a document. Last but not least, we have the access history. And this logs, the access to your record is constantly monitored and logged. So, for example, the information on the access history page of your My Health record shows actions from the past 12 months, including the time and date of access to your My Health record, which healthcare organization or authorized person, like a nominated representative, have accessed your record, the action that was taken on your record. For example, if they retrieved medicine information, you can see that, and the details of your own access to your record. Now, as you can see, there are many ways you can control who sees what in your My Health record. Now, let's have a look a bit on the benefits. So now we've learned about what My Health record is and the privacy and security of your health record, health information is. It's time to look at how you actually make the most of it. And I think this is what most of you are here for. So in this part, we'll focus on multiple benefits of My Health record that can support you in your health journey. But we'll look from different angles, in the end, all benefiting to your health. So we'll look at the benefits for you as a patient, for your healthcare providers, and we'll also look at the benefits for any of the representatives representing you on the My Health record. Before we do that, I'd like to first show you a video about Latoya and how the My Health record made her life a lot easier. Okay.
Latoya has diabetes and she uses insulin to help manage it. She comes from a remote community a long way from her nearest city, Darwin. Latoya was having a holiday with her family in Cairns. She was excited and forgot to bring her insulin with her. She is worried and thinks she will have to go without this until she gets home.
Her nephew is a health worker and told her that she can't go without her insulin. He tells her that when he went away on sorry business recently, he forgot to take his medication. However, he knew that the GP could look at his My Health record and see his medical history and medication, so he didn't have to go without it. He makes Latoya an urgent appointment at the Aboriginal Medical Service to see the doctor. He also tells Latoya that she can show and share her own My Health record information by using the My Health app. It's fast, easy, and secure, and you can access and share it all from the palm of your hand.
Latoya is happy that she won't have to remember her medical history or the name of her medication, and goes to the appointment at the Aboriginal Medical Service. She talks to Bill, the health worker at the medical service. He takes her blood pressure and discusses why she has to come to see the doctor. She tells Bill she forgot her medication and doesn't remember the name of her insulin she uses, and has been worried that she wouldn't be able to get the right insulin. She asks Bill if they can see her My Health record.
Bill says that they use My Health record all the time and will be able to access her My Health record to see her medications and medical history. The GP can see that Bill has updated Latoya's clinical file, and he accesses her My Health record to check her recent HbA1c results and asks Latoya if she'd like to receive an e-script by SMS on her phone or a printed paper prescription.
She likes the idea of not having to have a paper script and requests the e-script. When the GP sends the text message to her mobile, she receives the text message straight away and lets the GP know she can see it.
Latoya goes to the pharmacy and tells the pharmacy assistant that she has one type of insulin she normally uses. The pharmacist checks her My Health record and can see which insulin she had last dispensed and tells Latoya, this is your insulin that you normally use. The pharmacist dispenses the prescription and then sends the repeat token to Latoya's mobile phone. Latoya is happy that she has a My Health record. She feels more confident about traveling anywhere in the country and not having to retell her health history or remembering the names of medications. And she is going to download the My Health app on her mobile so she can easily show and share her My Health record information.
My Health record is a safe and secure place to keep your key health information. Available to you and your healthcare providers anytime, including in an emergency. Download the app today.
Okay, I think you can hear me. My camera is very slow. Give it 1 second to... Yes, there we are. Okay. Thank you everyone for watching that. I hope that gives you a little bit of an impression of some of the benefits that there are for us. And yeah, it's quite an enlightening little video, I think, to see it really in power. So let's start with the benefits and the benefits for patients like you and I. My Health record allows you, your representatives, who may be your carers, and your healthcare providers to access your healthcare information promptly. This includes any information about medications, allergies, and medical history that's in your record. There are multiple documents that you can add yourself, as we pointed out before, to complete your healthcare story. This may be critical healthcare information to your healthcare providers, meaning that having this information available, for example, during an emergency, could be life-saving. Think of information like your allergies, adverse reactions, medicine information, advanced care planning documents, and emergency contacts. Also, it's secure and it provides convenient access to your health information on the go, and it provides you with safer, faster, and more efficient care. You can personalize your My Health record in a variety of ways, which we've kind of discussed already, but I'll just recap them for you. For example, you can set your privacy settings to your liking, meaning you manage who sees what in your record. When you can view and add information in your My Health record, you can keep track of your health and any medical conditions that you may have. It also means that there's less need to remember key aspects of your medical history and medications, and the need to repeat that every time you visit another healthcare provider. And I think the video we've seen of Latoya underlines that very much, that she does not need to repeat her story all the time, about her medical history and her medications. And I can actually testify from my own experience as a diabetic type 1. I see a lot of healthcare providers, and giving them the ability to actually use the My Health Record information makes everything a lot easier and faster and smoother.
Sorry, Koen, just to interrupt for a second. We're not seeing your slides at the moment.
Oh dear. Yes. Okay. I'm sorry about that. Thank you for saying that. I'll have a little look what's going on. Please bear with me. Oh, I hope that story kind of comes together on this slide. Can you all see that? I'll just check.
We can now,
text.
yes.
Yes, thanks for saying that, Kathy. I'm having a little bit of trouble here because usually you can actually see which screen you're sharing in Zoom, and I can't for some reason today. So that's why it might seem a little bit bumpy, but please bear with me. As I mentioned, from my own experience, I can definitely testify that having your health information accessible to all your healthcare providers just makes your health journey, your health story a lot smoother. Now you can access it online through all of Australia, and that means, like Oscar's parents and also Latoya's story fits that, you no more need to bring all your health information when you're traveling around. It's all in your My Health Record. So going from the patient's benefits to benefits for healthcare providers. So healthcare providers can access the system to view and add information. And as Pip already pointed out, that is very important. Sometimes that's harder than you think to get that information in, but we're all getting there. And as the numbers already pointed out, it's growing and growing. And yes, without that information, My Health Record would not be possible. So again, it can improve coordination and the insights into your up-to-date medical information, and which improves the coordination of care between your different healthcare providers. And it reduces the risk of medication errors too, which is very important. And it's particularly useful when you visit multiple healthcare providers. As I pointed out, they can all be on the same page, providing continuity of care. When your healthcare providers can view your test results, it significantly reduces the need for repeat tests and procedures as well, which cost everyone a lot of less effort, particularly the patient, not needing to go 2 or 3 times for the same blood test, and it saves also a lot of money. Another great advantage for healthcare professionals is that they can see the big picture of your health, as I pointed out, but they can do that instantly. And therefore, in case of an emergency, they'll be able to provide you with the right care when needed. So I've mentioned these terms before: nominated representative, authorized representative. Let's start explaining about the nominated representative. It's actually a great benefit of the My Health Record. So what is it? What do they do for you as a patient? Now, you can choose individuals you trust to access and manage the information in your My Health Record. These individuals are called your nominated representatives. There's no limit on the number of nominated representatives you want to have. You decide what they can see and do, and you can invite an individual to be your nominated representative. So why are nominated representatives important? Well, nominated representatives can help you access or manage your health information when you cannot do it yourself that well. This is particularly helpful, for example, in the following scenarios. Children who have just turned 14 have a My Health Record access that they need to manage themselves. As you can understand, being a teenager does not really want you to do that. So having a nominated representative like a parent or a custodian is very handy and very useful. So that's one of the scenarios. It's also useful when for older Australians who require assistance. Besides that, individuals with a disability might really benefit of having a nominated representative. But also individuals who speak English as a second language, it can be a great help to navigate My Health Record. Next are authorized representatives who fully manage your My Health Record when you can't. An authorized representative is a person who has parental responsibility, legal authority, or is otherwise appropriate to act on an individual's behalf. An authorized representative is typically a parent, a carer, family member, a legal guardian, or someone with enduring power of attorney. They have complete access and control over the person's record as if it was their own. So this is different from nominated representatives who have limited access, which is determined by the level of access given to them by you. Authorized representatives can view, remove, and add information. They can choose whether Medicare information is added to the record. They choose which healthcare provider organizations can access the record, set access codes, which means they can restrict access to specific documents with the record or to the entire record. Add or remove nominated representatives, view other authorized representatives, or they can even cancel the record and delete it. An authorized representative must make reasonable efforts to identify and support the will and preference of the person they represent. If the will and preferences of the person cannot be identified, an authorized representative must act to promote the person's personal and social well-being. A person can have one or more authorized representatives, that brings us to actually a video I want to show you about the roles of nominated representatives. This video is about Terry. Terry is hearing impaired, and in the video you'll see how his life, well, even though being hearing impaired is very hard and difficult and really makes life very difficult, having the nominated representative by side makes life a lot easier for him and really improves his quality of life. This will also be the last video we'll see before we go to the panel. Yeah, if I don't get to talk to you after this, thank you very much for tuning in and listening to my little story about what my health record is and how you can benefit of it. I hope you got some new information from it. Yeah, let's watch a video.
Terry's my grandfather. I like to call him Pop. Yeah, he does a lot for us with our family. He helps all of us all the time. He takes my son to school for me and he picks the kids up from school too. Without my pa, I can't function. Like, I can't go to work and I can't do my daily routine without my grandfather. He is a fantastic bowler. My pa's been bowling for, I think, 35 years. He's very dedicated to it and brings a lot of joy to him. He actually was going to miss his own granddaughter's wedding because he had championships. My pa has a hearing impairment and he was born like that. With everything, I have to speak on his behalf. Whether he comes to me with a letter or if I have to book him an appointment.
A lot of our patients who have hearing difficulties, they also then of course have communication problems. So going to a lot of specialist appointments, a lot of the time they miss things.
I find it hard for people to accept me.
Hearing loss actually affects multiple aspects of our health. It's not just missing what people are hearing, but missing those communication opportunities, missing those social interactions actually has a negative effect on mental health.
He gets very anxious and frustrated because as he's hearing impaired, it's hard for him to explain to a doctor what is actually the issue on the day or whether he's getting results or whatever.
Doctors and other health professionals, they don't really understand what people with hearing difficulties need, and they don't always pick up on a hearing problem. They won't always pick up that the patient hasn't actually heard what they've said, especially if the patient is just nodding.
He might be lip reading them and thinking, oh yeah, yep. And the doctor might think, oh yeah, he understands.
Mishearing a word in day-to-day conversations might not be too much of a problem, but when it comes to medical issues, it could have some serious consequences.
He has been given medication that he actually is allergic to, and that could have been fatal too. It is really scary. You know, he lacks a lot of independence because he's always got to have somebody with him when it comes to communication. I think by him having my health record would definitely be a really big help.
It would make things a lot easier for his doctors to be able to access that instead of having to potentially misinterpret what he's trying to tell them. And being able to type in my notes so that other professionals can see them as part of a whole care plan will actually really help the patient to be taken care of better.
He might actually feel a bit more independent being able to go to these places. They can look at it and he doesn't have to tell that story over and over. It would be a help even for myself that I wouldn't have to attend all those appointments all the time. It would be really, really good if I could access that because then I could see what's going on too.
I want to be able to do more things myself.
Okay. Thank you to Kern for the presentation. That was great. And the videos, I think the videos are excellent. I think they really sum up some of the issues. We're going to go to the rest of the time we have together for a Q&A, and there are a few questions in the chat, so we'll get to those in a minute. Before we go to the questions, I'd like to introduce you to Dr. Kathy Rainbird, who is the Manager of Education at the agency. She's going to join us on the panel. So welcome to Kathy, and Shannon has pasted her bio into the chat. We might go straight to the questions, and I think, Pip, you've partly answered this one. If we can take down the slide and have people live, that would be great. The first question that we got very early on was from Jane, which said that she lives with chronic disease and only one of her health providers uses My Health Record, which is her pharmacist. And how do you get health professionals to start using My Health Record? And then why do public hospitals not use it? And we've heard Pip's solution to the issue, but we maybe, Kathy, if you have a view from the agency about how you are working to get health professionals to put people's records up.
Yeah, thanks, Jo. Hi, everyone. Nice to be here. We certainly have been working closely with all of the state jurisdictions, so the public hospital systems across all the different states and territories, to encourage them to get connected, and they now all are. So pretty much all the public hospitals would be uploading discharge summaries at least. Some hospitals across some jurisdictions have had different projects running to upload other documents as well. So the discharge summaries at the moment are only if you've been into hospital, admitted into hospital, and then discharged. So it's not, doesn't include your emergency, if you've been to the emergency department, that sort of information. But some hospitals are starting to look at perhaps uploading those emergency discharge summaries. Others are also starting to upload specialist letters from their outpatient clinics. So you can see those in there now. So we're working with all of the states and jurisdictions, encouraging them to take on these projects and implement My Health Record more and more across their hospital systems. But it is a long journey. It's exciting to see it all starting to really come to fruition. As Pip mentioned in the chat, 100% of WA hospitals are uploading their discharge summaries, and they've been really leading the way in terms of their implementation of My Health Record and uploading more and more. So it's very exciting. We are working with a whole range of other healthcare sectors as well, including private hospitals, as well as specialists. There was actually the trick with the specialists is that we had to get their software to enable them to be able to connect to the system. So getting their specialist letters to be able to be uploaded first meant that their software vendors had to meet the technical requirements and get the functionality working in their software systems. But now they do. And the good thing with that is they've actually built it so that it's a default to send those letters. And there's just a checkbox that says, do not send to My Health Record. So if you don't want something up there, you can say to your specialist, I don't want it uploaded, but it will default to go. So whereas other things have to be a bit more of an active pushing the button to upload something from, say, your GP, that default to send is fantastic. And that's happening across the board with all the specialist software products that are coming out now, which is really good news.
And that's happening with some diagnostics as well, isn't it? Like with pathology
That's
results,
right.
things
That's
like that.
right. And Pip, I have some exciting news for you. You mentioned about the that you want everything to be mandated. There is actually legislation, I think it passed through the House of Representatives, to make it that those pathology and diagnostic imaging reports are shared by default. That's going to be required. So from that, now that legislation is passed, it will be that they have to upload those results, which is very exciting news.
And
it is very exciting, and let's hope that the private hospitals and specialists also have to share by default over time.
That could be coming.
So I think, Shu, did you want to add anything about how you can encourage your health professionals to load up or to put stuff up? Are you right with what we've got so far?
So I would suggest the consumers to proactively ask. That is the only way, for me, if there's no legislation, that's probably the only way for consumers to get that done.
Thanks. I think it's good advice.
Joe, there was a question in the chat about GPs uploading, and that's straight to Shu's point about actively asking, because there isn't a shared by default option for GPs at the moment. They have to curate the summaries that they upload, and it is a bit more of an active process for them. So if you want your information in there, ask your GP, say, can you please upload a shared health summary to my record so that that key information is there? Or if there's a specific event that you want included, can you please upload an event summary that summarizes this so that that information will be visible to other people? So advocating for yourself and asking them to do that is a really good thing to do.
Yeah, I think that's good advice. And I think, sometimes it can be intimidating to ask your doctor to do anything. I asked my specialist to put my results up and got a blank look in response. But I noticed my pathology results are now up, so that's always a step in the right direction.
I'm so sorry to interrupt, but there's a little part for me here too. It's about technology. We need to invest in the technology. So my understanding is it's a fairly clunky system that has to be used on the other side. And I just want to make a plea too that we think about digital health projects not as a burden and a cost, but as an investment. This is a huge investment in our health and in value-based healthcare.
I think that's a very good point.
I've got some good news on that front too, Pip. Part of the work that the agency's doing at the moment is to modernise the My Health Record system and make it less clunky for the clinicians at their end. So I think it's even the health minister referred to, for a lot of the clinicians, it seems like a sort of shoebox full of PDFs, but this modernisation project will make it work better for everyone. So it's a bit of a shoebox.
It's a bit of a shoebox of PDFs for consumers as well. And we'd love one day to just be able to see our blood results, for example, on a graph, so we can manage our own health.
That's the blue sky coming picture, coming hopefully soon, but it might take a while.
Well, we hope. Leslie asked a question which I think a lot of people have asked, I know, in previous conversations, which was about, there's a mistake on my own health record and no one seems able to change it for me, and all saying it's not their responsibility. And Leslie said this has made her wary of information that is uploaded, which I've heard from many, many consumers, and I'm sure Pip and Shu, you've heard that from other people. What can people do about information that's wrong? How do they get it changed, or is there a process that they can go through? Kathy?
Do you want me to respond? Yeah.
Yes, I do.
Yeah, I wasn't sure if Pip or Shu wanted to say anything about that, but I can take that. Certainly, basically, once a document is uploaded, it's the authoring organisation that can take it back down if there's a mistake. So say it was something that had been uploaded by your GP and there was something inaccurate, it's asking the GP to take it down and rectify it. And their summary should be based on their local clinical record, so you'd hope that they've fixed it in there, and you could ask them to upload a new shared health summary if you wanted to. The other option is, like Kuhn mentioned in his presentation, is that you can actually manage your My Health record yourself, and you can hide any information that you don't want visible in your record. And so if there was something that was inaccurate, I would recommend going in and hiding that document straight away, because then that means no other health professional will be misguided by that information, if that makes sense.
I hope that answers your question.
I was going to say, I agree with that. And I just think, you know, the Queensland Digital Health Consumer Charter talks about, I have my health information is accurate and kept up to date. I know how to have my health information corrected. I'm supported by my healthcare team to update and correct my health information. I don't think that's quite what's happening in the real world all the time. And that's what we would love from a consumer perspective.
Totally agree.
There's a Shu, did you want to add anything on that, or just chime in?
No, I personally don't have that kind of experience, but yes, I agree with Casey. I think the easiest way to do that is to hide that incorrect record and maybe upload personal, the consumer's own record to try to remind professional healthcare professionals or yourself that this one is incorrect and we can't use that.
I think that's a great idea. My concern from a consumer perspective is that health professionals will still be able to see the incorrect thing. I think it seems to propagate. It's really hard. It's like whack-a-mole, you can't get rid of it. And we really should be able to get our records right. But certainly in my health advocacy days, when I did individual advocacy in WA, that was one very common thing, and it's quite a battle, and I don't think it should be. There's the thing called open notes where we get to see what's written about us in real time, and that's like we're a long way away from that as a nation, but that's where we need to get.
If I can just pick up on that bit, because it addresses some of the questions and comments that have come through, which is that there's a difference between what gets loaded up to My Health record as a shared summary and the clinical notes held by specialists and GPs. And I wonder, if either you or Shu want to comment on that, because I note from the questions that people are frustrated, but you don't get to see the full clinical record. Your medical notes that your doctor keeps are theirs, and your My Health record is yours, and they're not the same thing. Kathy, can you explain that a bit more clearly than I've just done, or maybe Pip can?
Happy to jump in, Jo. So yeah, My Health record doesn't contain absolutely everything. You're exactly right. The clinical notes or information that's held by your general practice or by a hospital, it doesn't have all of that information. It's really just a summary of the key information and those key documents that Kuhn mentioned in the presentation. So it's not absolutely everything that goes into My Health record. It's a summary and a sort of secure online repository for that summary information. So it can be really frustrating if you want to see all of your notes, because it does mean that you have to go through a different process to see that. And Pip, I think to touch on what you were mentioning about the whack-a-mole of the misinformation, it's usually the misinformation in those clinical information settings that's the issue of something being wrong, which is really hard to correct. But in My Health record, it's just that summary information, and like I said, you can still hide that. So it's the getting it correct in those bigger clinical information systems, say the hospital's record. Getting it corrected there can be more of a challenge, and that's where I think that's what Pip was mentioning before.
And I think go ahead.
I was going to say, I think from a consumer perspective, and because I've spent a lot of time actually, asking for notes and getting, huge piles, one of the first things you do as a consumer advocate is you try and create a story. The summary is really important. You don't want to know every single blood pressure and what time it did and which nurse it did. You want to know what's the tracking of a time where something missed. So I think the summary thing is really important, but I would just go back to that idea. It's quite radical for clinicians to think that there'd be a program like Open Notes where they would be required to transparently write about us as they care for us. But why is that so radical is a question I ask. And I think, you know, it's about, like, you know, we are a bit of a way from being the sort of empowered patients I think we would like to be.
I can just follow up because Linda has raised this. When you move doctor, when you move from one clinician to another, from one doctor to another specialist, if you want to move your records, in some jurisdictions, you can be charged for that. So people can pay. So you have to pay a fee often to the doctor who's packaging up your records to go to another general practice, for example. You have to pay. Kathy, you don't have to pay for anything to go on My Health Record, do you?
No, you don't. So while it's not that full clinical history that your GP might have, that they might charge a fee to transfer to another general practice, if at least they upload a shared health summary, then that key information, that key summary information, will be visible to any other healthcare provider who might be looking after or involved in your care. So at least asking them to do that is a really good way of getting some of the key information shared without having to pay that fee that might be charged for the whole lot to go across.
So I hope that I hope that
it's a wicked problem, I think. You know, I think, you know, private practices can charge. It can't be excessive, but it's a barrier, I think. I think it's our information, but, you know, that the feeling is that it costs time and money for the health service to provide it. So it's one of those things.
I think if we can get more, and I think maybe once we get more people actually loading up summaries and get GPs who put people's full medicines use on their My Health Record. And so as your My Health Record becomes more populated, you actually might have less need to get your actual records transferred because the key information is going to be on My Health Record. So we could list that as a benefit to consumers. And so I hope that answers your question, Linda, because I think there's a confusion about, and Carleen also raised the same issue about, you know, how do you get specialists to upload medical records? And they instruct my GP not to release their reports to anyone, including me. And, you know, and when she has access them, they've been incorrect. We hear this all the time. It is about who owns the medical record. And I think, I'm not sure whether this has been tested very robustly, but there seems to be an understanding that that record actually belongs to the doctor. So even though it's about you, the doctor is the one who owns it and can decide what to do with it. I'm happy if anybody wants to correct me on that, but that's my understanding of where we stand at the moment. And I think is why Pip's talking about open notes. Pip, have I got that right, that it belongs to the doctor?
Well, I think you're right that that's the status quo. I think morally and ethically it belongs to us. I mean, for example, it's a complex thing, but I say, for example, if you do your tax records and you send it to your accountant, they're still your tax records and not the accountant's. The accountant does all their sort of schnizzle, but it's still yours. So I think there's a couple of things going on because, like, the clinical care that you provide, you know, I can understand people want to track that. They need to understand that they're delivering the right care. They need to be able to go back and look and quality improve and all those things. I personally think that in Australia, we need a My Health Record Act and we need to really tackle this issue of ownership. And I think we just dodge around it, but one day we're going to have to tackle it. And I think it's our data, it's our bodies.
Yeah, I agree. I think that is consumers, you know, and as consumer, we have the right to information. So that should be ours. And when we request that, there should be no cost to us.
Yes, and the Queensland Consumer Charter agrees with that. It's just unfortunately not what's happening in the real world. And I think it would be important to think about that.
I might just ask one last question that came up. That's very true, Carleen, about who pays for these tests and everything. Can imaging, and you might be able to answer this, Kathy, can imaging be shared on My Health Record rather than reports? So if you have a scan of some sort, does the actual image go up on your My Health Record, or is it just a report of it?
Generally, at the moment, it's just the report. I know I've heard that some of them include a little thumbnail of the image, but that's not good enough for a lot of the clinical decisions that need to be made from a diagnostic imaging report, it's to do with the amount of data that takes up to upload an image in the high definition that's required. And if you think about the numbers of those diagnostic imaging reports and the amount of information that includes sort of in terms of computer storage ability, it's so huge that the system at the moment can't hack it. So at the moment it is just the reports, unfortunately.
What I
Time
would,
might come once when we have quantum physics computers, where we can have all of that data in there and have all of the images as well.
Yeah, you can, of course, many imaging places now send you a link to the record of your thing, and I guess that means you have to then keep it, which we're going back to. Instead of having a suitcase full of your scans, you'll have a thumb drive full of them, because you'll have to trot them around, or you'll have to have something with terabyte on it to even take your
Most
images
clinicians
around.
actually have access to portals to the diagnostic imaging services. So if they can see on your My Health record where you had your imaging done, that can be really useful, because then they know, oh, okay, I'll log into this portal and I'll be able to see the image there. So that's a useful thing to be aware of as well.
Yeah, that's
and there are patient portals as well, where you can actually see your images. It's just that from a consumer perspective, that means you might have to end up with 20 apps, and you sort of have, a whole street of one-stop shop front doors, all these virtual front doors that aren't in fact one stop. It's a whole lot of stops, but I guess it's those things are iterating and developing.
I'm going to have to call. It's a great conversation, but I'm going to have to call an end to it now. We're going to do a second poll, which if you could put it up, Shannon, that would be great. Basically, we're trying to see whether we've achieved our objective. So after today's presentation, do you feel like you can now make the most of My Health record? Yes or no? I'll just give you an answer. I'll give you a chance to answer, and then we'll have a look at the results. I think we've probably had long enough, Shannon, if you want to just show us what we've got. So that's very encouraging. Thank you so much. Thank you so much to our panelists. 82 people said that they now felt that they could make the most of their health record. We've obviously still got a bit of work to do to convince some people. And Carlene's made the comment in the chat that it's all with the caveat that, yes, with the information that's there, but we need more information, as we have clearly discussed. So obviously, for those who use My Health record, they want it to be more useful. And it's not that they need to learn, you all need to learn how to use it. It's that more information and the right information needs to get on there. And I think that's a job of work that us CHF as advocates and all of us who advocate to push for that. So that brings us to the end of today. I'd like to just encourage you to subscribe to our fortnightly newsletter, Consumer Voices, where you can keep up to date on all matters related to health policy and consumer engagement. Shannon, who's running this webinar for me, is the editor of Consumer Voices. And it's been wonderful to hear from such great experts and people who've shared their views. To Pip and Shu and Kathy and Kun, thank you so much for making the time and making it clear to us. And thank you to all of you for giving up an hour and a half of your time to joining us today. So with that, I'll sign off and thank you all very much.